How long are the effects of it?
How long are the effects of? Good question. So the effects of cannabis as a medicine depend on the route of administration. And there are a couple major routes of administration. The first is inhalation. And by inhalation, most people think of smoking. I rarely recommend smoking to my patients. In fact, most of the time I recommend for them not to smoke. Because the cannabis smoke has potential carcinogens in the smoke, and we also know that it can predispose to laryngeal problems, so problems with the throat, and also chronic bronchitis. You can inhale a steam of cannabis. It's called a vaporizer, and a vaporizer does not have the products of combustion. And the duration of action of the psychoactive and pain effects for most people is about 2 hours on the low end, and usually 2 to 4 hours. Some people will get up to 6 hours with that. When cannabis is taken internally as in an edible or as eaten, instead of being directly absorbed, which it is when it's inhaled, it goes to the liver first, and it's called first pass metabolism. It's a very important thing that the liver does. The liver performs a chemical action on the cannabis molecules, and it does two things. It increases the half-life of the molecule, so that it means that the duration of activity lasts longer, and it also makes it much more psychoactive. So anywhere from 6 to 16 hours depending on the dose, and for patients or recreational users who have eaten far too much cannabis, it can be over a 24-hour period, and most psychotic episodes that are induced by cannabis are induced by large doses of edibles for that very reason. And I want to also make as a note, no human has ever died from an overdose of cannabis ever in the history of all the medical literature, despite literally billions and billions and billions of uses. There is a third type of delivery method that is an oral mucosal method. Oral mucosa, the cheeks, and have you ever seen people who have heart issues take a nitrous tablet under the tongue? That's also absorbed directly. There is a cannabis formulation called a tincture. Any herbalists in the room here? Okay, a tincture is a liquid extract of cannabis. The tincture can be used two different ways. One is it can be put in the mouth and swished around like you were to do a mouthwash. And when you do that, I usually have patients do that for about 2 minutes. And it also will have a rapid absorption, and then if the patients would like a mouthwash, spit it out into the sink. That again usually lasts from 2 to 6 hours. However, if they were to swallow it, then they would get both the first rapid effect and then they would get a slower effect. So that's usually a very good method for patients who have epileptic seizures, or patients with migraines who need, if somebody has a migraine, and they need to nip it in the bud. Most oral migraine medication usually takes about 40 minutes to kick in. With this particular use of cannabis, you can get the effect literally in minutes into the body, so it offers certain advantages as well. To recap, vaporized and oral mucosal usually about 2 to 4 hours, and edibles usually 6 to 16. So what do you think we give a cancer patient with severe pain who wants to sleep through the night?
Edibles?
We give them edibles. Give them edibles or a tincture that they would then swallow because of the length of duration. Good. Okay, good question.